My name's Scott Salisbury. I'm a fertility specialist and gynaecologist in Brisbane. I've essentially done most of my training in Brisbane, having grown up in country Queensland. I did have a brief sojourn overseas in the UK, and that's predominantly where I started my infertility career. I worked in London for a couple of years, and that got me on the track of starting out in my journey looking after patients with infertility. I became a fertility specialist, and the natural progression is that most of us start out as obstetricians and gynaecologists, and it's very easy to get attracted to obstetrics and gynaecology because there's nothing quite like the love of looking after a lady and seeing her through completion and seeing that baby cry at delivery. And the natural extension of that is to begin at the very creation of life, and it's always intrigued me, always fascinated me. And over 30 years ago I embarked upon that journey by going to England to learn about IVF. And at that stage there was only a small number of people doing infertility work in Brisbane, and it's been a lovely journey. My approach to seeing new patients is to try and see them as a couple, so to see both male and female together, and that's often with same-sex couples as well. It's best to see them as a couple. And then I explore what they're desiring and what sort of time frame, and I think that's quite important because we'll often see people for simple reassurance rather than active treatment. And then we embark upon trying to establish a plan for establishing what could be the problem in their delay in falling pregnant, but also then mapping forward some treatment strategies that we may look at. And I think people always want to know where the next step is, what we're looking at in the future, and what's on my thought process, and usually I'll vocalise that to them. So in the normal scheme of things, that would involve a history, sitting down with them both and examining their past history, exploring whether they've had any management in the past, any treatment, any other medical problems that may impact upon pregnancy. And then I would try to also examine them during the first consultation as well. I always try and tell patients from the very beginning what I foresee pending the results about where we go forward, because people want satisfaction of knowing a plan both in the short and the medium term.